In the same context, you must have put a pink IV cannula, an 18 gauge IV cannula, to almost hundreds of patients. The cannula has a flow rate written on the backside of it. We have never seen, but I want you to start going through that details, because eventually that are certain one-liners that are going to be asked in competitive exams. People get confused in what is a green IV cannula, what is the gauge of that, what is a purple one, what is the blue one. So in spite of doing something 100 and 120 times, you still don't know the details of that particular action that you're doing, or the aspects of that action that you're doing. So that tells me, or if that is happening with you, that tells me that you have not put in much of thought into the activity. And if you start doing that, it is a radical shift of the whole approach towards whatever you are doing. So the art of being inquisitive, you have to ask questions. Another example that has come to me is when you're supposed to do a dressing of a wound. The most common thing that we use is a betadine. The first question that should come to your mind is, what is betadine? What is povidone into the iodine? What is the constituent? How does it act? So the moment you start asking these questions to yourself, two things happen. One is, there is no other erroneous or no other disturbing thought into your mind which clutters your whole action or your overall approach. You have a very systematic way of thinking towards whatever you're doing. And the second thing that happens is, you kind of revise certain things subconsciously. The next dressing that you do, you know the constituent of betadine, you know what is povidone, you know how it acts, and you just go on scaling up. Then your mind asks you what is acryflavin. It asks you what is hydrogen peroxide. It wants to know more about what are the healing agents on the dressing trolley. Why does it have silver into it? So these all are the scaling up of the mind once you have trained it into being inquisitive.